relationships, or you would see as academic pressure. In urban cities, you would see academic pressure, but also a lot of media influence. And जहाँ जहाँ आप देखते हैं कि media influence ज़्यादा होता जा रहा है, वहाँ आप देखेंगे कि you will see, because we know about the Werther syndrome. So somewhere those influences certainly change and shape a student's mindset, a child's mindset. So उनका जो ये था, उन्होंने ये बताया कि हमने काउंसलर्स को हायर किया एंड हम चाहते थे कि कुछ चेंज आए, और हमने जब देखा कि कुछ चेंज नहीं आया, सो द फर्स्ट थिंग दैट वी डिड इज वी रिमूव्ड ऑल द काउंसलर्स. ऐसे जो सोल्यूशन का पार्ट होते हैं हमने सबसे पहले उन्हीं को हटा दिया. चलो ठीक है, इन एनी केस वी हैव टू लुक एट द इंटरवेंशन, सो वील डू दैट. सो the point is, we've been talking about so much of problems in the last 2 days, and we are aware of all these problems. The statement of the fact is that suicides happen every 42nd. We lose an individual. Fourth leading cause of death among 15 to 29 years old. I mean, it's heart-wrenching to someone losing a life, something that we could have been absolutely prevented. We feel and we go through our own bereavements when somebody passes away because of natural deaths. And then you look at it over here where if we could have just identified, we could have just saved that life. That really needs to channelize our intent in different directions. And when it comes to suicide, it can't be just one level. We have to look at multiple levels because it's such a big aspect. And there are so many factors over here. मतलब आप पिछले 2 दिन से सुन रहे हैं, आप पेरेंट्स भी सुन रहे हैं, आप स्कूल भी सुन रहे हैं, हम सिस्टम्स को भी सुन रहे हैं, हम टीचर्स क्या करती हैं उनको भी सुन रहे हैं, हम ये सब कुछ सुन रहे हैं. बट प्रॉब्लम्स के सॉल्यूशंस कहाँ आते हैं? प्रॉब्लम्स के सॉल्यूशंस भी यहीं आते हैं, और वो हर लेवल पे करना ज़रूरी है. इट्स नॉट अबाउट जस्ट द काउंसलर, व्हाट द काउंसलर कैन डू. इट कांट बी जस्ट अबाउट व्हाट द टीचर कैन डू. So if we look at suicides over here and we try and understand the risk factors, the risk factors are, what do we look at? We look at personality, we look at mental illnesses which are undiagnosed and untreated. 90% of suicides happen because of undiagnosed, untreated mental illness, and very common of it is depression. Known facts. More than 700,000 million people across the globe, there are deaths by suicide amongst this population globally. Now, when we also look at other factors, these are stressors. Stressors for a child could be bullying. Stressor for a child could be academic pressure. Then we also look at the biology, जहाँ पर आपका mental illness आ जाता है. Then we look at access and means. And जब आप again media की बात करते हैं, I mean, I'm sure recently you must have read, there was a death in which a student used a fan. And the next day after that in the newspaper was as one of the interventions कि हम पंखों को ठीक कर रहे हैं. So when again, where are we going when it comes to the solutions? So these are some of the factors. Now you also have to understand the distal and the proximal aspect of it. हम क्या देखते हैं, जैसे हमने मीडिया में पढ़ा या हमें पता चला that there is an episode of suicide, we start to look at it more in immediate reasons of why this has happened. Our focus is over there. So if because of a relationship a child has lost their life, we will talk about that particular part. If there is a suicide that has happened because of academic pressure, तो academics वो है इसलिए वो होना चाहिए. हमने क्या किया, हमने स्पोर्ट्स हटा के ग्रेडिंग सिस्टम कर दिया. फर्क क्या पड़ा? सुसाइड अभी भी हो रहे हैं. हमने रिलेशनशिप्स के बारे में हम वो करते हैं, हम क्या करते हैं, हम उसी चीज़ को फिर स्कूलों में और स्टिग्मेटाइज करना शुरू कर देते हैं और स्टीरियोटाइप करना शुरू कर देते हैं. We start talking about why are you roaming around with that girl and boy? Why are you holding hands? You can't handle breakups, you can't handle that. What do we end up doing? We end up stigmatizing and stereotyping a lot of those things which have been existing. Now the solution over here is again to not be in the relationship, to discourage students that don't do any of these things. It's part of their life. I mean, biology hits all of us at a certain age. So this is also biology. It is going to happen. Attractions are going to happen, and that's a fact of life. So we end up seeing more at the proximal aspects, which are the life events. We also have to understand. So let's say there are 2 people, 2 students, student A and student B. Now student A had a relationship breakup, spoke to a few friends, spoke to family, engaged oneself in other hobbies and other things, and over a period of time is doing fine. Student B dies by suicide. You can't look at the trigger as the cause of that death. You have to understand that the distal factors which have been playing on for a long time and the tendency that has been there in this child would be personality, would be perhaps undiagnosed, untreated, some kind of a mental health problem, would be the coping aspects. In the long run, generally how the student copes with things. Maladaptive है, adaptive है, impulsivity एकदम से आ जाती है. And again, another myth where we talk about suicides as being impulsive. Because again, we are just focusing on the proximal aspect. एक event हुआ, उसकी वजह से somebody thought about it. But it's not like that. We have to understand a big role that the distal factors play over here. So personality, mental illnesses, biology, trauma, all of these things have a role to play. Now, if we look at it in the context of schools, what are some of these proximal factors? What is internal and what is external? So, स्कूलों की अगर हम बात करें, internally में क्या चीज़ें हैं जो आप लोग देखते हैं? पहली चीज़ है bullying. WHO has already said that because of bullying, most mental health conditions over a period of time happen in students, and we see it, the consequences of this even in them as an adult. Around 45% of boys and 37% of girls in a study in 40 developing countries have shown that they are bullied in school at some point in time. So यहाँ पर अगर हम बात करें, हमारा prevention क्या होगा? We know bullying होता है. Our prevention needs to be at the school level. What do we do about it? Can we start? I mean, the moment you go back from here, can you start with a survey right now? Once you go back, that what is the incidence of bullying in my school? And let me do an intervention of prevention and intervention for a year and then reassess it. Can I just do this one simple thing? And we have the surveys. If you want, we'll give you the surveys. We created a survey for students, we had created a survey for teachers, and as a part of the Bully to Buddy program, you do start with awareness, you talk about the impact, you talk about the psychological impact on the victim, you talk about why the bully gets bullied, why the bully bullies. Both have self-related issues. Dr. Buddha spoke about why self-concept needs to be talked about in school aspects. So both have self-esteem issues. And over here, a significant role is of the bystander, and I'll come back to that. The second aspect is academic pressure. Academic pressure, now we all know stories about, sometimes it's from parents. Parents talk about the kind of scores that student needs to have, but then there are also times when parents say, can I go out and play? But the student feels that pressure, that I am in a competitive world, how can you ask me to go out and play? I need to study and I can't. I am incapable of leaving my space right now because I'm very anxious that I will not be able to score well. And this happens so much, specifically in the urban sector, where you look at that there is some change happening in the parenting aspect, and the understanding, the awareness is a lot more, as opposed to you go far more in the demographic area. आप गुड़गांव दिल्ली में करेंगे कि थोड़ा सा डिफरेंट होगा. आप यहीं थोड़ा सा जयपुर सोना की तरफ जाएंगे, पेरेंट्स का एटीट्यूड अलग होगा. So we can't define that again where the problem is. The problem is आप ये आइडेंटिफाई करें कि कहाँ से क्या ट्रिगर आ रहा है, क्या कॉज है, क्या स्ट्रेसर है, पेरेंट में है, बच्चे में है, वहाँ पर what is the solution? So for a child who's feeling this pressure, school in-house help. Does the school know who are these students who need this kind of help? So what can I do in terms of being able to identify some of these students who need help for exam stress, because that's a reality. And when that happens, what are the coping that can happen? Can parents be educated on how to support the students when they are undergoing pressure? Talking to students about study and exam skills. उसमें हम क्या बात करेंगे? हम बात करेंगे मेथडोलॉजी की. पढ़ना कैसे चाहिए? 45 मिनट्स पढ़ना चाहिए. ब्रेक्स आपके लिए बहुत ज़रूरी हैं. Normal attention span is 45 minutes, and we have to keep reiterating it. Did you do self-tests? You have some anxiety when it comes to examinations. Why don't you give yourself a 3-hour test at home? Create a simulation. That's your solution. And these toolkits are what is going to help students to be able to deal with some of these things. So self-evaluation tests, create a simulation, stress-busting activities, all of that again then becomes a toolkit for something that can be just a trigger, just an event for somebody who's been struggling for a long time, but you are strengthening the coping. And now you may not know which child has how much coping, but when you give the toolkit and they start applying it, at least positive change is going to happen. So the ones who have a coping skill, it will strengthen more. For the ones who don't have the skill, they will learn. The third aspect when it comes to school, relationships. Relationships again, rejections we can't handle. I am rejected by that person, I am rejected by that person, and when you come a little further, even in today's time, when we look at young people coming with relationships, the more insecurity is about whether I can trust this person or not, because what if this person goes somewhere else? And सबसे पहली चीज़, I don't even know if this is the right person for me. At this particular age, you can't even make simple small decisions. You're talking about your lifelong partner जो हम आज तक सही टाइम से नहीं कर पाते, सही तरीके से नहीं कर पाते. So, ठीक है, it's part of life. You deal with it in that sense, and that's how you keep moving on with life. So, what is a healthy relationship? Students struggle with that. How to initiate healthy relationships, how to maintain relationships, how to sustain them. All of this is again a struggle. So, can I bring that as an aspect of conversations in my classroom, in my school, where I talk about, yes, it's absolutely okay to have these breakups. You look at and understand the dyads that are there around in your life. This is not the only relationship in your life. There are so many other dyads that you have. You have your parents, you have your friends, and every dyad has its meaning, it has its value. And then the value that you have, you focus on what is in your control. So that becomes a part of your intervention. And then the other aspect is media influence. Now, media influence even on the relationship aspect. हम जब यंग बच्चों से बात करते हैं अबाउट अट्रैक्शंस, हम ये बात करते हैं, हम बायोलॉजी की बात करते हैं कि जब अगर आपको सामने वाले को देख के गाने बज रहे हैं और आपके आसपास बलून्स आ रहे हैं और फ्लावर्स और ये सब हो रहा है, दिस इज ऑल बायोलॉजी. गिव योरसेल्फ अ मंथ एंड दिस विल गो डाउन. Then the real struggle will come in. How do I sustain this? Because it is biology. So, but where does it come from? You don't see your father giving your mother a flower every day. Neither are they singing songs to each other. They can hardly remember some dates. So, if that is what is happening, that's the reality. But what you end up seeing certainly misconstrues your perception and your reality in some way. So, again, media influence, media literacy comes over here. And since we know that how media reports about suicide also can lead to copycat suicides, which means when you talk about the method, when you talk about the details, the location, too much around what happened and not about what happened to the family. When you don't talk about the feeling of loss and pain. When you don't talk about the fact that there was a biological aspect also, there was a long-standing history. When you don't talk about that, then copycat happens. Celebrity suicides, again, lead to higher suicides. So these are all evidence-based researches that we know. So we know the problems. We need to just continue to work on the solutions, and they're not going to come in a short term. You have to give yourself a time. So you talk about media, you talk about media literacy, you talk about as media literacy as a toolkit in schools. Then you go on and how to use also media as a part of a Papageno effect, where you talk about meaning of life, you talk about how when somebody loses somebody and what happens to the bereaved. So that's your media. Now from here, so this becomes your toolkit for prevention. You involve parents, you involve teachers, you involve the management. You start with your surveys. You start with understanding what's happening in your school. This becomes your research, your model of intervention and prevention. Give yourself a year and see where do you reach. Toolkit, bully to buddy, anti-bullying squad, awareness at all levels. Then you go on to the academic pressure. Toolkit, study and exam skills. Focus on all levels. Parent education, teacher education, student education. Media, focus at all levels. Parent, student, teacher, again. Mental health, focus at all levels. Keep doing it periodically in your school. And then you see a change. Now if we go on crisis intervention. Crisis intervention is not like a conventional therapy where you have your time to be able to work on the patient. Crisis intervention is the moment a child feels that my stress has become a lot more and I can't handle it. And that moment, what can I do to reduce the arousal that's almost leading the child towards going in that direction? So, your goal is how do I reach there? So, the first step is going to be your warning signs. Warning signs are going to be what? If the student talks about meaninglessness in life, if the student talks about the relationships don't matter to me, I don't think so. People, if I leave this world, anybody would care. Your warning signs would be isolation. Your warning signs are going to be in terms of the change, behavior, tone, expression, words that they use. These are going to be your warning signs. Then you go on to the aspect of talking to them and understanding what is the intent. Where has it reached? Have they tried earlier? Is it still at the thinking stage? Is it just the ideation, or have they already started planning?